I'm Greg Jamian, and thank you for watching Boomer Health at Home, the show where we explore the most relevant healthcare topics impacting the baby boomer generation today. As more and more baby boomers seek answers to many times difficult healthcare questions, our goal is to provide ideas, tips, and cutting-edge solutions that will help improve your everyday life and health. It is our hope that you find the following information helpful as you sit back and watch Boomer Health at Home.
Hello and welcome to another episode of Boomer Health at Home. I'm your host, Ryan Donelon. Joining me to my right here, of course, is my co-host, Brett Pulte. Brett, how's it going today?
It's going well. It's always going well when we have a good Boomer Health segment going on.
That's great. Well, what do we have going on today?
Well, today we actually have President of America Medical, Greg Jamian, coming in. And Greg's actually going to talk to us a little bit about the different immigration policies and how it's going to affect the baby boomer generation going forward.
Very good. Well, a hot button topic. Of course, they always say don't talk about politics, so we'll be interesting to see what comes out on the show, right?
It definitely will. Greg's one of those people who's super smart about a lot of different areas of, not only politics, but home care and health care and, being able to actually just take care of people. Greg is a very intelligent person, and he's going to be probably the best person we could get to come on and talk about this subject.
Well, sounds great. Sounds like we got a great show today. So to hear about this and to meet Greg and more, stay tuned and don't go away. Welcome back to the show, and let's welcome our special guest, Greg Jamian here. Thank you for being here today, Greg.
Thank you for inviting me. Glad to be here.
Well, on our show, we really, when it comes to people's health care and their own health, we really want to bring some of the most up-to-date information on things that can impact it, be it a change. And sometimes, as you try to avoid to be political, sometimes the changes are coming from a political level. So we'd like to maybe discuss some of the new policies coming in with the new administration and the Trump administration on how that could impact the home health care business.
Well, Ryan, it's a difficult subject because immigration is good for any country. Workers coming in, new workers coming in legally, and I want to point out legally, fill the jobs that many Americans may not want to do, or simply the demand for certain sectors are so high there is somewhat of a shortage of labor. Certainly when we hit unemployment rates of 4%.
Right. Now, I know it's the baby boomer generation specifically, and that as they're aging, that's going to impact the home health care. What have you kind of projected to be the impact on home health care as far as growth or need for services based off of that?
Well, I like to use words like tsunami, tidal wave, a potential disaster if we don't do something about it. There's roughly 80 million baby boomers. These are people born between 1953 1946 and 1964, and the age group is roughly 53 to 71. But it's a huge cohort when you compare it to Generation X and millennials, and this is an aging group of people that are moving into retirement and therefore are going to put a huge demand on the healthcare system in this country and other countries as well.
Oh, of course, and like you said, since everyone's consistently growing in the healthcare industry, how many actual jobs are currently held by the legal immigrants in the healthcare industry?
And we're talking legal immigrants. You're roughly talking it's 24, 25, 23, somewhere in there percent of roughly 4.5, 5 million direct care workers. Now, we're talking direct care here, I assume, today. But, there's other segments of the healthcare industry that, immigrants can fill.
Right, and I know that Donald Trump's immigration policy changes looks to cut legal immigrants by 50%. Do you anticipate that impacting the job market?
I'm an operator of a home health organization and medical staffing, and the demand for our product is growing by 30% a year, and that's consistent with the people moving into older ages. So it's something that the policymakers in Washington are going to have to really pay attention to. I think the current administration is focused on illegal immigrants, kind of vetting the process of immigration into this country today, because for many years, past administrations, that vetting has not been done. It's the floodgates have just been open. As a businessman or an operator of a medical staffing company, we rely on government to do some of that vetting before we hire people, and we of course we want to hire legal immigrants only. In Michigan here, it's not as big of a problem as it might be in some of the western states, California, Texas, and so forth, where they're closer, to a border. Here, our closest border is Canada, and yes, we do bring in nurses from Windsor, right across the river, for example, to meet the shortage of nursing care from time to time.
And that's interesting. Like you said, the business has been growing, or the industry has been growing 30% year over year consistently. But you also told us that almost a quarter of the workers are coming from legal immigration, and like Ryan had said, with the bills being passed and looked at in Washington about the immigration reform, why do you think that this number is so high of legal immigrants working in the home health industry?
Well, first of all, the types of jobs that are available in home health care, are entry-level jobs, very, very important jobs. Okay, we have some of the best caregivers around, and they do angels work, and that's for sure. But the shortage is, getting new employees into our system. That's the new battleground. We used to say, we need to increase our business, but business is coming in, but it's, staffing a lot of these cases with vetted employees, and that's where our company is spending, Ameristaff is spending a lot of our attention right now.
Great. So yeah, it sounds like you kind of continuously have a wide variety. Is there anything that within AmeriCare that you guys do better than other companies? Like, how are you able to maintain such a good level to maintain your business? So years ago, our focus was bringing on new employees and bringing on business. Our focus now is really talent acquisition and treating an employee as a valuable asset versus a cost to doing business. Right. And it's that whole mindset, changing that mindset, that has helped us, meet our needs and hit the levels that we need to hit as far as bringing in new employees. It's, things like, work-life balance, working with them when they run into problems. We do a lot of different things. Our pay systems are weekly, which people really appreciate, and direct deposits right into their account. So benefits are another thing that we are now providing our employees to maintain the high level of staff that
is suitable to go out to your mother's home or father's home. It's the kind of staff that you would want.
Yeah, and that's always very important. And being more attractive to the highly qualified people is very important as a company. And with the immigration policies coming, with the different changes that your company has made throughout their hiring process and everything, do you see a change coming because of the immigration policy?
So I think the immigration policy is a necessary evil for right now, because for so many years it was out of control. I think there's a lot of people that agree with that. A lot of the immigrants, and it matters where the immigrants are coming from sometimes, and I know there's been a big push on IT and engineering, and less of a push on bringing in the lower paying, because in many cases those are considered unskilled, although I can tell you our employees are highly skilled because they go through a 4-point training program before they're okay or suitable to go out into the field. It is a continuing problem, but I think once they fix the vetting process, which they're working on now, from what I hear, it'll act as a screen and maybe reduce the number. But you gotta understand, when you talk about immigration, you're talking about legal and illegal.
Mm-hmm.
We want legal immigrants coming into this country, with
Right.
The appropriate documentation, because you don't know where these people are coming from. And I heard an interesting discussion on immigration coming, for example, from the Middle East, and maybe we have to do a better job at our company bringing in people that are new arrivals. But it's really hard to vet some of these immigrants because there's no records from the countries they're coming from. A lot of countries, for example, you can look at their baptismal records and confirm their age and who they are and where they live and so on and so forth. But some countries don't even maintain those kind of records or documentation. So it's very difficult. How do you vet these people? How do you we do not want to send a predator, for example, into somebody's home, regardless of what part of the world they come from, because our job is to be caregivers and provide safe, good care to the person that is ailing or senior, and so it's something that we pay a lot of attention to at AmeriStaff Nursing.
Great. So it sounds like the new policy will add almost like an extra insurance policy to make sure the best people are in the jobs. And of course, America is the melting pot society. We've heard it since day one. So my question is kind of more on the home care. With the melting pot society, if a family does have a different ethnicity or even a language barrier, how does that work with home health care? Is this a hurdle that's hard to kind of get over, or is there options for these families if they're here in the country already?
We are, the technology age is really helping our business. We're still a people business. I say we're in the people soup business. So high touch and not high tech, because the services we provide require caregivers to assist patients with ADLs and so forth. So it's really important to understand that the training that's necessary to go into these caregivers and to identify, we have patients that, for example, are Eastern European. They only speak a common language in that area of the world, and there are some common languages. I think Russian is probably one of them. So when we do get patients like that or clients like that, we're seeking out patients, or I'm sorry, caregivers that can speak that language. So therefore, these a lot of times they're new entries into the United States that have been properly vetted, of course. Sometimes they're just, caregivers that have learned that language growing up. So we try and match the cultural needs if it's requested, as best as we can. And we have Asian caregivers that speak, Mandarin. We also have Hispanic that speak obviously Spanish. So it's important consideration. We say that where we can, upon request, we'll try and do a cultural match, a personality match, because caregivers, sometimes the chemistry is not there. So we try and identify the chemistry, and certainly the skill match, because certain clients have a higher level of skill than others, and we want to make sure that we have the appropriate skill match in place that can take care of that patient. So, we go above and beyond to take care of our clients and meet, their needs, when specifics are requested, and within all, within the limits, of course, of the law. And so our clients are very happy when they can only speak, for example, Polish and Russian, and we send somebody that can speak Polish into their home, and that bond is built, and it's great when that happens.
That's great to hear, especially with the cultural diversity of Southeast Michigan. And Ryan and I both married Polish women, so we know how steadfast that population can be,
and how good the food is.
Exactly.
Well, and I was using Polish as an example because there are some new immigrants that come here, and extremely bright, smart caregivers. One of the things I know, an earlier question was, what do you do differently to attract, a high standard or quality or volume of employees? And one of the things is I like to say that we present a dream to these employees. Yeah, they come in, many of them $12, $14 an hour, which, I have to agree, it's tough to make ends meet, but a lot of these our employees, it's a second job for them, or they live in a household where there's other people contribute. But at our company, one of our competitive advantages is we have quite a few teaching RNs on staff, and these new employees have to go through a training process. And it's not just one time, it's continual. So they have RNs teaching them some of the basics of healthcare. So we're an entry point for a career in healthcare, which is the largest industry in the country, maybe in the world. Certainly in the United States, healthcare employs more people than any other industry.
Yeah, it's largest, and we just said it's growing too with all the baby boomers.
So if you were looking for a career and you were 20 years old or 22 years old, and you had nowhere to start, we can train you, get you started. And then, so many of our employees graduate from, let's say, a home health aide status or a nurse assistant status to an LPN, for example. I think an LPN for example, is a one-year degree. They go to school for 1 year at an accredited school, and they could be earning, $24, $25 an hour. So we provide that training. We encourage our employees to take the next step and train with us, and we and grow with us. And so many of our employees are now RNs. We even have a couple that have gotten masters in nursing, but they've started off as caregivers. And I'm particularly interested because I sit on the board of the Oakland University Nursing School of Nursing. And so, education is really important to me for healthcare workers. And I try and bring some of the best practices that I see at the university level into our organization. And we try, very hard to, bring our employees up to a standard that I think is higher than other companies that may be out there.
And education's very important to anyone that is being, in the health industry. But in your opinion, how does the quality of a workplace affect the quality of caregivers that you can put out in the field?
That's a good question.
That's a great question. and I always talk about the millennials because, of course, I'm a baby boomer. And working with millennials, I assume you're millennials, is a challenge for me. And people used to go to work, give it 110%, go home and call it a day. Now as an employer, you really have to build a culture in your company. And we think that we're learning every day, but we think we have that down pretty much. And little things like time off. Sometimes employees get into trouble and with their finances and behind in a car payment or something. We're always there to help them and support them, and they know that. The other thing is the younger people all want to be connected to a phone. So
yeah.
A smartphone. So our IT department continually is working to improve the connection and the communication piece to make it easier. In fact, you can apply for a job with our company entirely, online on your cell phone. And so things like that, making it easier, providing more access, it's really important. And we have to do everything we can to bring new people into this, growing industry. And you got people retiring, okay, and then you got the boom in age. Mm-hmm. So, we even look at people that have retired. A lot of women in our industry. Maybe their husbands retired or are still working, and they're 55, 60, and want to provide support services to an elderly patient. We bring those kinds of people, and we love those kinds of people because most of the time they're baby boomers and they got a great work ethic. But we love bringing them in and providing the basic training, and they receive a lot of satisfaction from that type of work many times.
And we know it's a great place to work too, because Greg's being a little modest here. We're just talking at the break. Actually, didn't you guys just win an award too with the?
Yeah. So, it's not. Don't take it from me. Okay? But when third parties come out and acknowledge, that you're a top workplace in Michigan, which, we did receive that distinction just recently, we brag about it because, keeping your employees happy is so important, and making it a safe, growing environment for your employees, whether they're your administrative employees or your direct caregivers. And the direct caregivers participated in the surveys that were sent out to achieve that distinction of top workplace in Michigan. It says volumes and speaks volumes and it validates the work we do on a daily basis to keep our employees happy. The last thing we want to do is have an unhappy caregiver go out to a person's home and be mad at the company for anything, because they could take that out on the employee. So, I'm sorry, on the patient. So, we're very, very careful to make sure that all of our employees are happy to the best of our ability.
Right. It sounds like a great place to work. Would excuse the pun, trump any changes made in the government. It's always going to be a good service what people
Yeah,
are
I
looking
think,
for. So.
last point, I think once the government administration fixes illegal immigration, I think you'll see an opening up in certain sectors because, again, with unemployment at historic low rates, we need workers in this country. Last point, I talked to somebody, and I'm not a proponent for it necessarily, but they said, the United States in the future needs to merge with Mexico. And I said, what? Mexico? Oh yeah, well, because it'll solve our problem for workers for our aging population, because Mexico has all these people in this population that that would want to come across to participate. But so I said, how would we pay for it? And they said, well, with all the oil, because Mexico is one of the largest oil-producing countries in the world. But so there's going to be a lot of new ways that people look at immigration and how to deal. If we want in this country 4% growth, like the Trump administration is talking about, we have to have the workforce to support that growth. And so I think policymakers will realize that sooner than later.
Well, that's great, and that's thank you very much. That's actually all the time we have, and as Greg mentioned, there are going to be changes on the horizon. We are happy to bring you up-to-date, real news and real experience on the changes being made. And if you at home have any questions about any content you saw in today's show, you can call us at area code 248-288-2270, or send us an email at boomerhealth@americaremedical.com. We want to thank Greg for being on the show today.
Yeah, thank you.
And it was a pleasure. And you at home, thank you for watching, and enjoy your day. Thank you.